everyone. I'm Dr. Shamdeo Prasad, Chief Medical Officer, and welcome to today's COVID-19 update. First, the global statistics. According to the World Health Organization, the total number of cases is 9,129,146, with 473,797 deaths. In the region of the Americas, the number of cases is 4,507,006, with 226,504 deaths. Now for the situation in Guyana. Of the 84 tests that were done, there are 6 new cases, bringing the total number of cases to 215. The number of COVID-19 deaths remain at 12. 108 persons have recovered. We have 95 active cases in institutional isolation, 16 in institutional quarantine, and 1 patient in the COVID-19 ICU. The total number of tests done is 2,355, with 2,140 persons being negative. Yesterday, we addressed the issue of the repatriation of you, our nationals, and the misinformation you are providing to our health officials on your arrival. Please note that the publication of your names is not designed to embarrass you, but is a part of our surveillance activities which help us to track this disease so that the management can be more effective. So we ask you to cooperate with the health officials whose work is doubled when they call and are unable to follow up with you. Parents and guardians, we are aware of the approaching July-August holidays, the time for fun activity away from home. We empathize with you because the pandemic has curtailed most of their outdoor activities, the most important being that they have been unable to attend school. The upcoming holidays will be challenging as you try to keep them engaged, but more importantly, safe. We therefore ask you to start thinking ahead of innovative activities that are just as fun, which can be conducted within the confines of your residences. Keeping your children safe is a priority, and we hope that you remain committed to this task. We also wish to remind you that our child health clinics and antenatal clinics continue to function as our children's vaccine and growth monitoring is an ongoing process. Our antenatal mothers still need to be seen and examined at clinics for us to ensure that the pregnancy period is safe and without complications. If complications arise, we would like to diagnose these in a timely manner so that management can be initiated early. We call on all parents of children that are due for their HPV vaccine, that's 9 to 16 years old, to seek this service at the nearest health center. The Ministry of Public Health remains committed to eliminating cervical cancer, but can only do this with your cooperation. My fellow Guyanese, we are currently in a prolonged period of restriction because of the contagious nature of COVID-19 that has called for a change in lifestyle. We can only survive this period if we make the sacrifice required of us, wash our hands correctly, as often as possible, avoid touching our eyes, nose, and mouth, wearing a mask, and staying at least 6 feet away from each other, and staying at home if there is no sound reason to step out. So let us work together to stop the increase in our numbers. Stay strong and healthy. Stay at home. Save lives. I thank you.